It's another Q&A edition of Optimal Health Daily, episode 845, and I'm Dr. Neil Malik. Hey there, happy Friday, and welcome to another Q&A edition of Optimal Health Daily, where I answer your health questions related to fitness, diet and nutrition, and lots more. You send me the questions, and I answer them for you. You may wonder, well, why should I bother sending Dr. Neil a question? And I'll quote Ray Dalio here, who's founder of the world's largest hedge fund firm, Bridgewater Associates, and recently wrote a book called Principles based on his life. Here's what he said in that book. Quote, "Listening to uninformed people is worse than having no answers at all." Unquote. I do hope you think that I'm one of those informed people. I do have my Doctor of Public Health degree with an emphasis in chronic disease prevention and nutrition. I also have my Master of Public Health degree with an emphasis in health promotion and health education. I'm also a registered dietitian nutritionist, a certified health education specialist, and a certified exercise physiologist through the American College of Sports Medicine. When I'm not doing this podcast, I actually hold 3 faculty positions at various higher education institutions. I've been featured in over 70 different media outlets for my expertise on fitness, wellness, and nutrition, and I publish research on the effects of diet and weight management. And if you haven't sent me a question yet and you want to, I'll explain how you can do that at the end of the show. So for now, let's hear today's question as we optimize your life.
Hi, Dr. Neil. This is Karen. I just wanted to start off by saying that I really enjoy listening to your podcast, and I do look forward to it every day. My question to you is kind of awkward, but it's in regards to bowel movements. Just kind of wanted to get your insight as to why certain people might go more frequently or less frequently than others. You know, I understand it might be related to your diet, exercise, and even stress maybe, but it's not necessarily about constipation. It's just like what happens in your body that causes you to go less frequently than others. If you guessed it, yeah, I don't really go that often, and it doesn't bother me at all. Like, I don't have any discomfort or pain or anything like that, but I just wanted to get your insight on that. Again, thank you for your show, and I hope you have a great day.
Thank you for your question, Karen, and thank you so much for listening to the show and for your kind words. They truly mean a lot to me. Now, I can understand how your question may seem a bit uncomfortable to some, but based on my experiences with patients and even my students, I'm going to tell you that many people have similar questions. Heck, Dr. Oz did a whole episode on this topic a few years back. In fact, I still remember when I was at school, when we were covering the digestive system module, a friend of mine asked our professor about bowel movement frequency, and he asked publicly in front of the whole class. At the time, my friend was following the eat every 3 hours, 6 meals a day plan. And he asked the professor, so how often should we be having a bowel movement? Our professor paused for a moment and then said, ideally after every meal. My friend then blurted out, 6 times a day? Luckily for my friend, this was one of the very few times my professor was incorrect. I'll explain. There have been studies that examine bowel frequency and disease risk, like colon cancer, for example. There are even studies that look at bowel movement frequency and Parkinson's disease. This is because when it comes to Parkinson's disease and bowel movements, the theory is that the health status of the gut influences the health status of the brain, also known as the gut-brain connection. Most studies have found that 1 bowel movement each day is about right. In some folks, 1 bowel movement every 2 to 3 days may be fine as well. Unfortunately, when we look at some of the largest studies on this topic, their findings differ. One large study performed in the U.S. found that those with 2 or more bowel movements each day did not have an increased risk for colon cancer when compared to those that experienced 1 each day. However, a recently published Japanese study couldn't replicate these results. They found that having a bowel movement once every 6 days or so had the highest risk for developing colon cancer. So it seems that depending on the person, having anywhere from 3 bowel movements a day to 3 per week may be considered normal. So, luckily for my colleague back in school, our professor was incorrect. 6 bowel movements a day would not be considered normal. Now, what actually determines stool frequency? So many factors: age, gender, hydration, medications, stress, diet, of course, body weight, and physical activity, just to name a few. I'm not going to discuss specific disease states like irritable bowel syndrome or IBS, or inflammatory bowel disease or IBD, because that would need a separate episode on its own. So I'm just going to discuss some of these lifestyle factors and assume that we're talking about an otherwise healthy individual. If we think about age for a moment, for those parents out there, even parents of baby animals, like your fur babies, you probably have noticed that these young ones often have more frequent bowel movements when compared to adults, or even when compared to their older siblings. As we move from young adulthood into middle age and beyond, stool frequency tends to decrease. Women, on average, have fewer bowel movements than men, but that may be just because men eat a higher volume of food in general. Those that have a higher body mass index may have more frequent bowel movements as well. It seems that walking or jogging may lead to more frequent bowel movements too. It's believed that walking and jogging stimulate the colon, the large intestine, to push its contents along a little more quickly. This is what healthcare practitioners call peristalsis. Medications. If someone is taking a strong pain reliever like a narcotic or even an antidepressant, this may slow down peristalsis and lead to constipation. When you take antibiotics, they may temporarily wipe out the good bacteria in your colon, which can change your bowel frequency too. You may experience diarrhea or constipation, it just depends. This is because antibiotics are built to kill bacteria. They don't know which ones are good or bad. They just kill all bacteria. What about stress? Stress can absolutely play a role too. In some, stress stimulates peristalsis, which causes more frequent bowel movements. In others, it can lead to constipation. So Karen, I wish I had more definitive answers for you. There are just so many variables that may influence bowel habits. But it seems as though having up to 3 bowel movements per day to 3 per week is about normal. Now, when it comes to diet and maintaining stool frequency, the scientific community mostly agrees that staying adequately hydrated, so drinking enough water so that your urine is a pale yellow color, and getting 20 to 35 grams of dietary fiber each day, ideally from whole foods like fruits and vegetables, appear to be most important. Both of these habits will help keep the gut microbiome healthy as well, which we agree definitely influences bowel frequency. Thank you again for the question, Karen. You'll be entered into a very small raffle every month to win a book. And you can send one in at oldpodcast.com/ask. Or you can do it the old-fashioned way and call in your question. The number is 61 I love OHD. Both methods are in this episode's description, which you can find at oldpodcast.com. All right, that's another week of Optimal Health Daily. Thank you for listening every day. Thank you for listening all the way through. Thank you for sharing this show with someone. Have a wonderful weekend, and I'll see you back here on Monday where your optimal life awaits.